Welcome to Vet Life Reimagined. Today, our guest is a great example of possibilities in veterinary medicine. Dr. Ricky Walther will explain how he wrote his own job description for his ideal career, but he had some stepping stones up to that. Ricky was very involved in vet school, which was at UC Davis. He was inspired by one of the leaders of their orientation week and decided to join the Veterinary Business Management Association, or VBMA, during his first week, and he later became the president. He attended the national VBA meeting, and that further opened his eyes to possibilities in veterinary careers and planted the idea of a particular path for himself. He also decided to run for office for the national VBMA, and his connections there started him on a path of self-reflection, as well as connections that would lead to his current position with Pawlicy Advisor, a free platform to help understand pet insurance options. Ricky later started to understand that his personal why is around service, and he has created a fascinating career as one of the few veterinarians involved in transforming the pet insurance space. Now, unfortunately, Ricky's audio is a little rocky, but I am so inspired by this conversation and his positive attitude around veterinary careers, as well as his enthusiasm for making a difference in a unique area of animal health. So let's get to the conversation with Dr. Ricky Walther. When did you know you wanted to get into veterinary medicine?
Yeah, well, thank you so much for having me. I'm super excited to be here. When it comes to when I really been one of those people who always wanted to be a veterinarian. I think everybody in my life has told me that as soon as I talked, I was telling people I wanted to be a vet. But it really was until I was in high school where I woke up one day and realized, I should actually make sure I know what that means. I should find a veterinary clinic that I can go to and see what this is all about. And so that was kind of I would say I've always wanted to be a vet, but the way I got into the profession really got excited about I think sophomore in high school, deciding to go in and I'm going to go get a job at a vet. I went into a clinic that a friend of mine had actually volunteered at over a summer and told the practice owner that I wanted to work there. And she asked me why, and I said that I've always wanted to be a veterinarian. And she kind of looked at me and she's like, okay, well, I can hire you and you can work with originals and clean and kind of start there and work your way up. Or I cannot hire you and you can just shadow me for a couple of weeks and make sure that it's truly what you want. And I came to the clinic every single day after school for 3 or 4 weeks and saw what it really meant to be a veterinarian and working with the veterinary team. And that was really when I knew that it was what I wanted to do. And really the piece for me was I love medicine and I think it's fascinating, but I love seeing how the doctors help owners through a really challenging time and what kind of an impact we could make on not just people. I've always been a very extroverted person and love to talk to people. And so I think that was the piece that was like, no, I can do both. I can work with animals and help people and their animals together. And that was really what sealed the deal.
That's a very wise approach. And I'm glad you learned very early on that there's a lot of people involvement into our profession because, you get those people who say, oh, I want to go into veterinary medicine because I don't like people. And it's like, you might want to pick a different profession.
100%. I would say, it's funny because I think the best analogy is kind of like being a pediatrician. Right? Can't do anything just with the dog. Yeah. Have the owners involved in that conversation.
Yes, it very much is a people business, which the funny thing is that a lot of times I hear, I did love the animals and that's what initially attracted me. But a lot of times I also hear though, well, what kept me in veterinary medicine were the people. And I think that's also a beautiful part of it too, because like you said, you get both. You get the animals and the people that come with it. So that is a really cool perspective. Now, I know you went into vet school at UC Davis, and it seems like vet school was a really big part of your veterinary story. You were extremely active, a lot happened, and a lot of those things helped or came back around within your career. So do you mind sharing a little bit about, one, getting into vet school? Did you have an idea of what you wanted to do and did that change? And then feel free to share some of the ways you got involved.
Yeah. So vet school for me really was kind of very pivotal. And the reason why I say that is because I went to Davis for undergrad and I was able to study pre-vet just like everybody else and knew I wanted to go into veterinary medicine work. But I think of a similar story to a lot of people. We're into vet school and then it was almost, well, now what? No. Like I knew I wanted to ultimately work as a veterinarian. I thought that I kind of liked the idea of owning a practice one day. And I remember the summer leading up to starting vet school, I had a lot of anxiety around like, well, what does this actually mean? And so I think I started and was waiting and really came in with the mentality of like, I'm just going to absorb as much as I can. I'm really glad that I did that self-reflection of not being 100% sure, because I think it made me really open to the things that happened to me. And I remember UC Davis on what they call prologue, which is basically the first couple of weeks, like orientation. And it was prologue at Davis. It's led by one of the teachers for VBMA, so the Veterinary Business Management Association. And I remember he had kind of made a comment during the week around what he does. He teaches some of the business curriculum. And so I remember I was super nervous and just here, this person's not going to want to talk to me. I'm going to send him an email anyway. And I sent him an email that first week. Honestly, I said, I think I'm interested in bid. Like, what should I get? And little did I know that one email actually led to him being a primary mentor in my life for 4 years during vet school. And one of the first things he told me is, well, you should get involved in the VBMA. Here's when they're doing their info session, go. And so I was excited because I was like, okay, there's a club about this. This is exciting to me. This feels like something that we're not veterinary focused. I knew I was eventually going to need business skills, communication skills. And so I took that skill set, was like, oh, this is really interesting. I can get involved and see what comes of it. And so I remember I started by running for an officer position for the VBMA. I always have a president-elect that's typically first-year student. And so just like many of the clubs, that kind of is a nice way to get involved in leadership. And fast forward a couple of months, I was sent as part of that position to the national meeting in Orlando for the national VBMA leadership meeting. And I remember walking into way bigger than I had ever imagined. I went to the event, the panel of 5 people who are all veterinarians, all in different parts of the industry, talking about innovation and forefront of what was coming. And I remember watching these people sitting on this stage and, none of them were still even in clinical. And that just totally blew my mind. I had no idea that people like left clinical medicine to do other things in the profession. And so I remember, they were like, you should apply to be on the national board. I was like, well, I'm just a sheer student, just get involved in this. That's way too stressful and anxiety inducing for me at this point. I'm going to go home and think about it. And I remember I went back and, I thought about applying to be part of this national thing to run the national VBMA. Got really in my head and told myself that, no one from Davis had ever done it before. They're not me. It's going to be too hard. And so I didn't. I stayed really involved at the school level. I ended up being classed and really involved in Diversity Works. And it didn't fun the next year when I went to Ukraine. I felt that same kind of energy that I felt the first time around. Like, wow, there's so much out there I can be doing. I need to experience this. I want to learn what's there. And so that year, when one of the officers came up to me and said, you really should apply for the national board. I remember you from last year. We talked about it, didn't apply. You should do it. And I remember I was like, okay, what do I have to lose? Right? Nobody from Davis has ever done this, but why not? I can figure it out. And so I talked to every single national officer there. I learned as much as I could those 2 days while I was in Orlando. I came back and I applied to be on the national board. And that was something that was hugely out of my comfort zone. I've always done kind of local leadership stuff, but never felt like I was able to play on a national scale at any time. So I put myself out there and sure enough, I was elected to be on the national board. And that experience, the 18 months of running the national VBMA with a group, the best experience of school, and it just catapulted my understanding all the things that exist in veterinary medicine. It solidified for me that actually clinical medicine is exciting to me, but it's not my passion. It solidified that the rest of it, helping veterinary professionals do what they do best, was where my passion. And so it was really fun to kind of investigate during that school and really set me up for a lot of other aspects I'm sure we'll get into around my career and kind of where I am now. But I think that initial piece of putting myself out there, getting involved, And meeting people and building a network is really what changed it for me.
Yes, and I'm glad you mentioned there the networking piece as well, because I think that is really big. I know some people still don't like the term networking because for some people it feels icky, but it's not. It's really relationship building. It's meeting people, broadening your connection base. But also, I recently heard someone else explain networking as it's two-sided, right? It's also you being able to figure out what value you can offer other people. And so I really like that. And I think that's something I see in your career journey as kind of a theme. So I think that's really, really important to kind of emphasize is that even when something feels intimidating, like talking with people, not everybody is an extrovert, but it's really important to build these relationships. We're a very close profession, meaning that there's only a few degrees between somebody else and so that is super, super crucial. And as soon as possible, like even in vet school. And I don't know if this was part of VBMA, but did you experience it's called VLE, the Veterinary Leadership Experience, also during vet school?
Yeah. So that, I think, to be honest, like, the national VBMA is really what gave me the like exposure to like what career existed. But the one moment of my veterinary school career that really changed the ways was actually VLE. So all the national board sent to VLE actually before we even know what position we're going to be, right? So like we show up to VLE, we meet the people we're going to be running this organization with, and then we go through a week-long intensive self-reflection and self-discovery kind of experience to really figure out, the value we bring. And I think one of the things that the VLE does an amazing job for the profession is really teaching you the value you do bring to any kind of situation, and helps with some of the self-awareness that I think is really necessary as a leader. That was the first time I'd kind of been exposed to the idea of servant leadership and, helping others experience and grow together. And so that was at the very start of my VBMA experience was VLE. And then to your point, I think it helped me with that other side. And I think we all go into networking, like you mentioned, looking for like, well, who can we meet? What am I trying to get out of it? And that's the part that I think feels uncomfortable or odd to many people. But the VLE really taught me the opposite. It's like, what are you bringing to, like, what you bring something to every relationship. Part of you're in control of when you show up in every moment, whether or not, networking is comfortable or not. I think the skill sets I learned in VLE really helped me to know that like, to process those emotions, understand I'm getting stressed and anxious. Here's why. I'm feeling like I don't provide value to the situation. I feel like I'm potentially not enough to be speaking to someone who's a CEO of a company or the different people that, right, you get in your head around their title. And I think VLE gave me the skill to be able to show up to that moment, figure out like, well, what is the common thread? What can I bring to the table? And really boosted my confidence heading into this position. I had applied to be the president of the VBMA, but it was they saw in me and they actually gave me that. And I don't think without VLE and understanding kind of like you just mentioned, both sides of what networking and relationship building is, I don't think I would have been as successful in it. I mean, it was my job to talk to all of our sponsors, managing all of our sponsor relationships, the external communication with the industry. And I was often sitting across the table from somebody who was a CEO of a very large company or chief medical officer of a big company. And some of these people were like idols of mine, people that I had been watching their career and looked at them as I want to be. I'm on the other side of the table asking them for funding. And so you have to kind of psych yourself up and get excited about it. And a lot of those skills that I learned in VLE. VLE is actually kind of interesting for me because not only do I learn so much about myself, but it's actually the connection that led me. And so that I think it's just another piece around being open to opportunities and meeting people in really unexpected places. Friend VLE in my group is the person who connected me to the company that I now work for. One of the things that, as I reflected more on my kind of networking journey and the journey I went through in vet school, I think, I viewed it at the time as I was just in the right place at the right time. After kind of revisiting it, I've realized that I think also it's a really intentional piece that I chose to do, which was to be open to these opportunities, put myself out there and to be open to responding when somebody says something and to making those connections. I think something a lot of people sometimes I think get wrong around putting yourself out there and networking is that like, it doesn't just happen to you. You don't just put yourself in these situations and hope that something happens. Then you have to be intentional. You have to go in open to something that you may never have considered before, because those are often the actual opportunities that lead to the longer term path.
Exactly. Luck is when effort meets opportunity. So there is an element of you do have to put in a little work. You do have to get outside of your comfort zone. And that's when you meet the opportunity. It may feel like luck, but there is a lot of effort still that you need to put in and be a little intentional about some of those things, which you clearly have been. And along those lines, you currently work for Pawlicy Advisor, but I think you had an encounter with them in vet school too, because isn't that when you started doing some pro bono advising for them, like giving them a different perspective? And how did that happen?
Yeah. So that is the connection piece. So at BLE, my group, they have reached out to him and said, hey, we're working on this really great market that helps owners in transition. Would vets be interested? Friend said, I'm not really into like the business side of veterinary medicine very much, but I think I knew somebody to help you. And he actually reached out to me right after the fall after VLE was in the summer. Said, hey, like Ricky, do you want to talk to the company? They have this really cool idea. I think you might. And I remember I was kind of in my head about it, and I was like, how am I going to help them? Like, I was more than happy to talk to these people, but like, they're starting insurance marketplace, their company. Am I going to be able to tell you? And so I took the meeting. I scheduled a call with them, and I heard their idea, heard how they really wanted to simplify the conversation, give people option, and they wanted to do it right. They were brand new as a company, and they wanted to make sure what they built resonated with the community. Remember, on the call, they were asking me different questions. When I heard their questions, I was like, oh, these are all questions about my experience, like an experience I know and every veterinary professional knows very closely. And we've all been in the clinic. We know how these questions get. And so I realized very quickly that I did that. And actually a lot of the advice I was giving them was super helpful. And so the one call turned into two, turned into 10. And I just really kept in touch with them throughout all of veterinary school till I graduated. And when I graduated, we actually formalized that relationship. And, they wanted me to be their advisor for the profession. So I offered to do that. And so I graduated, was working as a small animal veterinarian, and on my day off, I had at least one call every week with their team to review different things they were thinking about, helping them with how are they going to show up at conference. So it was a journey of, I made that connection, was open to meeting somebody who, had a different network than me and was able to make this mutual connection. And then I think what really helped was me being proactive around staying in touch with them, being excited about what they were doing and being invested in, helped to keep me front of mind for them. And we really built a strong relationship has now led into me working for them full time.
Yeah, and I definitely want to get into that, but there's a little bit in between. So you already mentioned graduating, going off to your first job, and you've really been prepared in a lot of different ways to start entering into the veterinary world. And you also mentioned that you had been able to see lots of different possible career paths. And a lot of these non-clinical roles were still really interesting to you. So how did you make that decision to transition from vet school to veterinarian? And what was that first year like?
Yeah, 100%. So I think that when I was in vet school, I was exposed to all these different careers. I knew based on my experience with the national VBMA that at some point in my career, I was going to want to move. I just could feel that was what was pulling me towards it. But what I knew that I needed first was really a strong medical foundation. And I knew what it was like to work in the hospital, but I didn't know what it was like to have the stress and ownership responsibility that being the veteran leading the team is. And so I made a very conscious effort to find a clinic high volume caseload with really good mentorship with lots of different doctors, because I knew that learning quickly different experiences within veterinary medicine was important to me. So I chose a done internship at clinic. And so I was stayed in touch with doctors, I connected with them and ultimately ended up choosing to come on full time there. My transition out of vet school was a little bit unique, I guess, year wise. It's not unique in this, everybody who graduated when I did experienced the same, but I graduated in 2020. I was all fourth year of school because of the pandemic and started as a vet in the very height of the pandemic when we were really trying to figure out, like, how do we even just in the constraints that were out there. And so my transition to being a vet was definitely rough. I was expecting to go into the hospital. Everybody knew exactly what they were doing, and I was just going to learn from them. And instead, we all learned together, right? We learned what it meant to be a veterinarian during the pandemic together, and what it meant to stand 6 feet away from someone's car and talk to them to build trust and build a relationship when I wasn't able to do so over the phone. And all those things kind of came with it, which I think actually benefited me a lot because I learned so much communication and a ton of doctors work with each other, all things that have been really helpful in my career since. But I still knew, right, wanted to spend a couple of years really learning what it meant to be a veterinarian. And so that led me to first role as an associate at that larger hospital. It's also what led me to be a medical director for a de novo hospital that they were opening with a corporate group, because I wanted to see what it was like to do that, right? Build a hospital from scratch, understand what goes into it, and understand what it means to build a team. So I was very intentional with my choices for those first 2 roles because I knew I needed to gain that experience in order to set myself up for a non-clinical role. And I had told myself, somewhere 3 to 5 years after graduating was when I wanted to transition. I ended up making the transition pretty much at the 3-year mark. And I think part of it was because I felt more confident in myself.
Yes, I believe that really good leadership can also be further highlighted in really challenging situations. I was fortunate to work for a company with, at the time, the leadership was fantastic in leading through the unknown of the pandemic. And with 7 doctors, like you said, that's 7 different ways of not only veterinary medicine, but probably ways of leadership or talking to the other people in the hospital. And so you really got to, sadly, very quickly see 7 different potential ways, at least. I'm sure there's some coming together to agree on the policies of the hospital, but ways of understanding how to lead through the unknown. And leadership itself can be challenging. Leading in the unknown is even harder. And so being able to see that type of leadership, I think, is really crucial. So I definitely can see how that expedited your ability to see the importance of leadership and all the different things in a hospital that can go well, but also go wrong. And how do you fix that? Like, how do you problem solve? Because when you're in the unknown, again, we're adapting. We're going to try this. If it doesn't work, we'll try something else. And I think honestly, it's a really good way to approach a lot of different things because we're in medicine, right? There's a few things that will seem fairly routine, like vaccines. For the most of the part, there's always the one reaction, right? But for the most part, those things are kind of routine. But understanding how to behave when things do not go well or as expected, I think is so, so important. And I'm sure that came up many times being in the pandemic for you.
Yeah, definitely. And I think that, graduating in the pandemic, I think one of the things that's interesting is, you are in the unknown every day, right? And I think I talk a lot about how it's helped me grow and learn a ton, and also want to acknowledge that not always easy, right? Like that was a really hard time for, I think pretty much everyone can agree that medicine, it was really challenging. And for me, that showed up in feeling burnt out in what I was doing. And I am lucky that I was given opportunities during vet school like VLE to really be able to understand and be self-aware around what I was feeling. And so what I think helped me is I feel and recognize that something was draining on me. And instead of just being frustrated with it, I really tried to figure out like, well, what is it about like, what is it that I don't like? What do I want to try to find in an opportunity? And really, I was somebody who experienced burnout pretty quickly because of all of those fears and all the stress. And the 6-7 months in, I was like, oh, this is really hard. Like I need to figure out a way to move myself forward. And so for me, I really did a lot of reflection and fell back on that I loved these leadership positions that I held, having an impact on the voice made me feel valued and come every day. And that was actually what kind of led me to my medical director position, putting myself out there again. Again, a year and a half out of school, being a medical director doesn't sound like something I could do, but the doctor saw something in me, saw that my skill set went well to it and let me take the leap. And I think the reason I let myself take that leap is because of the reflection that I went through during the first time period of burnout. I know I want these leadership opportunities. So I might be scared of them, but I know it's going to drive me. And then it was also things like I did reflection and realized like I love new puppy, new kitten appointment and getting to tell an owner like all about the preventative medicine that they can accomplish and what they can prevent their from getting in the future if they do certain things. And I liked that way more than having, a diabetic. And for different people in our profession, I think there's different why. And so for me, kind of telling myself those things was actually what led me to the position that took starting a hospital inside of a pet store, and getting kind of preventative medicine mix every day of people walking into the store with new. And so I think that really helped re-energize me in veterinary medicine. And it was being intentional around looking at this is what I do like, and then continuing to check in with myself over time. And that's really, I think, led me to ultimately reconfirming to myself that these things that I wanted in a job were different than clinical medicine.
Yeah, and I definitely see how your appreciation for preventative medicine also plays into the pet insurance side of things, because those are prime times to talk about insurance. And not puppy and kitten visit. And I still think it's so funny that you had said that the first hospital that you joined was a very large percent. I think you said 60% of the practice was like English and French bulldogs, which also are very good opportunities to talk about pet insurance.
Yeah, you're correct. So the first pet insurance team, I had met Pawlicy Advisor as a vet student, right? And so I knew about insurance and was learning about the industry slowly over time. When I started at a hospital that worked with a bulldog rescue, and so therefore we saw a very large percentage of French bulldog, English bulldog mixes coming through our doors. It was very obvious to me, and actually very much highlighted the need around talking around financial pieces of preventative medicine, right? It's not just about the medicine. It's also about preventative finance. Having a full conversation with owners around how they can pay for the treatment that they're looking for their pet over the lifetime of the pet. But it was very obvious to me to see, owners that did have insurance, or that we talked about insurance quite a bit, as you can imagine, with the breeds we saw. And the owners that did have insurance and had made that decision really were able to do more and not worry as much. And so I loved seeing that at the doctor. It allowed me to, and it made those conversations hard to have with the owners that didn't know it was an option. Can't tell you the number of people who came in and they've never heard about it. Well, that owner might have actually benefited from it if they known it existed. And so I became really passionate about the financial pieces too. And also just, it became part of my kind of spiel. Like I learned, when my Frenchie preventative medicine spiel is different than other dogs, right? And so I liked learning how to customize it to be what that owner needed to hear. Because most of these people spent a lot of money on this dog without any idea of how much money this dog might cost them over the litigation. How do we make it feel like a partnership? And how do, and help them understand, like they need to actually also be really careful on which policies they choose and making sure that they cover the kinds of things that it's going to get and that they needed experts to help them with. Pawlicy gave me kind of a nice it was nice to know they existed because I had and helped to licensed professionals that could answer those questions for my owners and direct them. But I think that, yeah, you're right that the insurance piece was always kind of a thread, and my experience double clicked just how important it was, which really helped me to feel like when I made that change, I was doing it because I was making a difference. Because for me, that's one thing I learned very early in my life. And I think is what led me to veterinary medicine and kept me excited is service matters to me a lot. Huge core value of mine is to be in service of other people. And so that's how I look through a lot of lenses. And so VetMed, filled that, and I wanted more. I wanted to have a wider impact. And, now gives me that ability to impact a wider audience.
And even you mentioned that there's not a lot of veterinarians that are sitting inside of the pet insurance world. So your perspective, your seat at the table is extremely valuable to make sure that we really are making the best opportunities when it comes to pet insurance. Because I think we all understand that insurance is important, but we don't always necessarily know what is the best way of doing this, right? Because we don't want the human insurance. They've got their issues, right? But then there's still some challenges over here. So you got to have all of these different perspectives that can come together to really vocalize and figure out, solve what really is the best for the pet and the pet family, so that we can continue to serve them and do what we came to do in veterinary medicine. So I think that's so crucial. And I'll get excited about pet insurance, so I'll try not to talk too much about it. But with you coming into Pawlicy Advisor as a full-time position, they actually, it sounds like, kind of said, well, we need a chief medical officer role, but they'd never had that role before. So they kind of said, what do you think it should be? And so how did you go about, because it's kind of a neat opportunity, right? You can put in some of the things that you're very self-reflective. So some of the things that are really important to you, but then also having to figure out what's good for the company, right? And their needs. So how did you go about basically writing up your job description?
It's a great question. So that was really important to me, right? I wanted to make this transition to have that impact and to provide that service. And like you mentioned, there aren't a lot of veterinarians in insurance space. Comparatively, in pharma and things, far more medical professionals, which makes sense, but there's still a need for our voices in all of the aspects of what we do, right? And so pet insurance for me, the biggest thing I wanted to do was make sure that this role allowed me to, one, make sure that the decisions the company was making that we couldn't make. With any tangential company, right, that most of the people that work in the company are not familiar with what it's like to be in a veterinary, right? That's not grounded, totally fine. And we needed to build in ways to make sure that I could help those things, right? And I mean, little simple things. We've all seen the marketing ad where the dog is standing on their leg that's in a cat. And vets are going to look at that and be like, that doesn't make sense, right? And so it's tiny, tiny little things that needed to be in my job description around catching something that maybe nobody thought of, that makes it resonate and feel more genuine and show up as the right brand, right, in the profession. All the way up to the pieces you also mentioned around advocacy and advocating for what we want insurance to be and what thousands of hospitals across the country want it to be. So I needed my job description to span a lot of things. And I didn't have experience in what this looked like. So the way I wrote my job description was it was using my network and connecting with the people that over the last 5 years to go to a bunch of people, some that have had this job, but others that not necessarily were chief medical officers, but worked for companies that, what do you see your chief medical officer doing? What do you wish they would do more of? How can they kind of craft the role that makes sense? And I think what I found from that is that the idea of being a veterinarian in a role like a chief medical officer with a company can mean a ton of different, and it means a different thing to every company. And so I kind of got overwhelmed and said, oh my goodness, there's so many things I'm supposed to do in this role. And then you did have to do exactly what you mentioned, which is we're a startup. We're still growing, and we're still growing to have the impact we want to have. Right? And so it's what do we need now as a business that really helps to grow, and where can I provide value? So I started looking internally at what are my translational skills? What am I good? I know what it's like to be in the hospital. I know what it's like to have the insurance conversation. What resources did I want in clinic that I didn't, that would have been helpful? And that's actually where I started. I started building out like, what can we do? What kind of resources can we provide veterinary teams? And it kind of helped grow our customer success side of the work. And that was where I started in my role. When you ask like, what is my job description? The answer is it changes all the time. Right. And I think that that's exciting to me. My job description is to kind of be responsible for the user journey of veterinarians from the time they meet us as a business all the way through to hopefully when they've partnered for multiple years and feel really confident in having this conversation with them. There's lots of little things that fit in along the way. And that's where I involved my work to figure out like, what are those things, as I look at 15 years, what do I want to accomplish in this role? And some of those fit farther down the road, right? Where we are a bigger company, we have a bigger impact and all those kinds of things. And some of them are more short term. And so my job description involves everything from those edits on marketing, helping with copy that goes up, building resources for teams. I also have a team experience with conference. I help with a lot of our conference, how we show up at a conference and what is thanks to the national VBMA and running the national meeting gave me those pieces. But it's been, for me, it's been around how like all these translational skills of things that didn't know I was going to do in the future, bringing them into my role now involves advocacy. It involves sales teams work directly with teams, and our product is free, right? So we don't want anyone to feel like we're selling. We want them to feel like we're a partner, right? Because it's a free service and we want to make sure that the hospital can utilize it to the best of their ability. And so it's a very different perspective and something to help those teams with as well. And so it's been really fun for me to kind of look at that. And then my most favorite part of my job is helping on how can we partner and strategize with other people in the industry on ways that we improve. One of the things that, anytime I speak, I really tried to make sure to say that, but pet insurance is not the solution for every single owner. And we have to know that, right? Like we have to know that and be willing to talk about it in conjunction with all of the other financial tools that exist within the profession. For vets and vet teams, when they're in the room with the owner, they need to not just have one option. They need to have multiple options. And that's really how we're going to help with the concept of financially triaging with an owner and really moving that needle forward. So that's where I see my role kind of growing, and that's what's exciting. And knowing what to do day one was talking to a lot of different people and relying on my skill set. And I think that's one thing that I really like to relate with others around my career. And I love talking to students about this, is that I did write my own job, which means that you can too. Like, you want to do something in veterinary, then you need two things. You need to idea what that is and how you get there. You need to understand the business impact of how those things, right? You can't go in and just say, I want to do something that makes nobody any money and doesn't have any way for anybody to fund it, right? So you need those two things to be true about what you want to do. And you also need people. You need to have that question, the right question, finding the right people, because an idea doesn't turn into actual reality without a lot of people's input. So I think that's exciting to know that as a DVM, I can do a lot of different things. I can do clinical practice. I can do a lot of other different jobs, and we can even build and I think that was really freeing. And I think something that like, I wish I had known that the build your own options existed a lot earlier, because I think it would have given me a lot more time to really investigate it. And
Yes, definitely. I mean, that's one reason for the podcast is, right, really showing the possibilities. And a lot of that is understanding some of the ideas, but then being able to attach your personal values with those possibilities and writing it yourself. But you make such a great point that parts of that is not just being able, which sometimes even this part is hard, to put into words what you want, but also to be able to understand the other side of the equation, the business side of the equation. Because if you don't understand the business needs and the value that they need to make something successful, then one, they either may not buy it, or two, it may be short-lived because the business goes under because, right? I mean, that may be extreme that one person does that, but it is important to be able to look at that perspective. And you being in a leadership role, also, yes, you bring really unique value, but you also have to understand the company as well so that you can participate in those discussions and bring your perspective to make it relevant for the business. And it can be really challenging. I think some people forget about that part. And then also I love the third is you also have to have a team. Very rarely do we do anything in life all on our own. How we got into vet school, yes, it was a lot of work on our own, but there were probably people who encouraged us, who gave us the experiences, like all of those things. Like life is not done in a singular bubble. Life is a team sport. You really need other people. So being able to account for the others in the equation, I think is so huge.
Yeah. And I like what you actually just mentioned around, kind of weighing. There's a lot of things to do. One of the things that's been really interesting to me, I'm a veterinarian. My insurance is one. What's been fascinating to learn is all of the pieces that go into how consumers and actual owners want it to operate, and how sometimes the way the vet teams want it to operate and the way that owners want it to operate are not always the same, right? And so when we talk about any issue that's worth solving in veterinary medicine, there are many sides and many factors to be considered. But like you mentioned, it's about a team of people coming together, sharing ideas. I know full well that Pawlicy Advisor and myself even are not the only people that can make these changes, right? Like we need lots of other people to move forward. How do we have this conversation? And we need more people to do similar to what I did and what many people that you've had on this podcast have done, which is to think about a new idea and a new way of trying things. And it's okay to fail, right? Like many things, like nobody accomplishes anything without failing a couple of times. We just normally only hear about the part that went, right? We don't hear about the many other things that didn't go to the thing that we learned from them to get to the end result. I think another really important piece is just understanding that any issue we're solving is super complicated. And that's actually what I like about it, right? It's kind of what I think brings a lot of us into veterinary medicine when it comes to the aspect, right? Like these are puzzles we solve. These puzzles exist outside of a clinical case. They exist in a lot of other ways too. It's fun because some parts of my job today are the exact same as what I was doing as a doctor. I'm still looking at a problem, analyzing it, figuring out what the possible causes are and how to fix it, right? And skill set can be translated absolutely any role. And it's something we're really good at as doctors. And I think that's something that's fun to be able to tell people is that they can take that. And, I work on a lot of our operational efficiency. Never thought that was something, but because I'm a doctor and I'm used to running a team and I know what needs to fit and what when things fall through the cracks, I'm really good at also looking at those same things in a business process. And so I think it's all about knowing your skill sets and knowing what you kind of want to achieve.
Yeah, that is definitely huge, is to recognize. And I definitely see it in veterinary professionals is we learn a lot of different skills that can be very translatable into other areas. And I think that's one way that makes us so adaptable and flexible in what we can do long term. If you are interested in different ways to take your career, is to be able to recognize that vet med can actually really equip you with a lot of different skills that are going to be very valuable in a lot of different settings. So I'm glad that you recognize that. And I'm glad that some of these other companies also recognized it as well, whether it was doing a from scratch clinic and also becoming a chief medical officer for a young company. I think those are people that could see that skill set in you as well.
100%.
Well, I don't know if I fully have time to ask you this question, but like I said, I'm very fascinated by pet insurance. And I think it has been in the news. It's been some hot topic for lots of different reasons. But I would love like a hot take from you when it comes to where we are today, because we've got lots of articles talking about rises of veterinary prices for care. We've got, access to care talks. We've got some companies who have, I don't know if it's firing their policies, but, basically saying, we're not going to give you a policy anymore, and which is kind of terrifying. And then you even mentioned that, pet insurance may not be the right answer for every single pet, which I also find very fascinating. Again, I'm sure we could do a whole episode on this, but just in general, high level, where do you feel right now that the pet insurance is and the part that it can play? And what are you looking most forward to in kind of bringing that to VetMed?
Yeah. So I think that there's two things that I think are really important in kind of what you just highlighted. One, we're at a pivotal point, right? And things are coming to a place where we just start thinking more about the financial aspect of care, right? It's inevitable with the way that prices are increasing with the tightening of owners' discretionary income. Every owner that has a pet is looking for ways to afford the care that we all want. Nobody can argue with. And that's going to require a multifaceted approach, right? It's going to require innovation in the pet insurance space to make sure that these policies are sustainable and that they can be continued to be supported. And I think something we're going to see a lot of changes over the next couple of years around what it means to be a stable insurance product. Something that, I'm really excited for us to continue to work with our partners to help innovate on. And then I think it also really is important for the veterinary community to change how we talk about things, right? We can't do what we've done, I think, for a long time, which is every vet for a while had their spiel of like, I recommend this one thing, based solution, or any of those different insurance, right? Whatever that option is, I think we're used to something quick and easy. And we need to all kind of understand that it's not a quick and easy conversation. Right? And so I think profession needs to brainstorm and come together on ways that we get creative around how we have these financial conversations with vet teams so that they can have them with others, right? How can we position different products that exist in the market together to help owners, when one maybe has a shortcoming that another doesn't, right? And so it's about a multifaceted approach to this financial topic. And I think the other thing is that requires on the behalf of the owners, right? We experience as veterinary team, we see these owners go through these really challenging in the room. And we need to help all these companies that are creating solutions, them understand what the true pain points are and how can they help solve. And so again, kind of back to what I mentioned, right? Like any problem we're solving in veterinary medicine is multifaceted and a lot of collaboration. And so what I'm excited about and excited to be part of is watching a lot of companies that thought they were in markets or different parts of the profession that didn't connect, working together. And that's what I'm excited to see. I'm excited about some of the opportunities that we've been able to have around working with, companies, PIMs, different things like that, help revolutionize the way that we talk about insurance, but also how we work with companies that have nothing to do with insurance, right? And just are part of that financial story. And so that's what I'm excited about. And I think that at veterinarian, if you have ideas, if you think of stuff, if you have ways you think better, it's reaching out to the people who are in these rooms, myself and others, help bring those to the surface, because I don't think anybody has the magic line, right? There's not a single thing out there right now that fixes the rising cost of care and financial affordability of care. But there's a lot of different people working on how we do solve that. And so I think being part of is what I'm really excited about. And I do think, rightfully so, we are at a pivotal. It's going to show up news, going to be there. We're going to experience changes. And it's all about, I think, how we react and come together. But similar to how the whole profession came together to solve how the changes that happened with the pandemic, right? We need to see that same thing happen with a lot of the care and affordability of care.
I think that's an amazing response. So thank you. And I get very excited when we can bring so many different groups together to solve a problem. I used to use the word connector because I loved that. I didn't always know my value except that to bring people together. I can definitely see that because I do see an amazing potential to solve problems better when we can do that. And so that whole mix is super exciting to me as well. So again, I can completely relate to that. And so we only have a few minutes. So I'll just give you my last final question. And that is, what is something that you are most grateful for?
I am most grateful for the people I have met in this profession. Always embrace the idea that one of the things I'm most grateful for is just the fact that everybody who I've encountered in veterinary medicine, like you said at the beginning of this, that people stay for the people in that profession. It's so true. I'm grateful for the fact that I can call pretty much anybody that I've met throughout any of my veterinary journey and ask them a question, and bothering them, they'll give me an honest answer, and they're transparent and open, right? Even if something that's going to, help me potentially more than it helped them, it's okay to them. And that's what I'm grateful for, is that we have really amazing people in this profession. And I'm just lucky that I get to work with so many of them on a daily basis.
I hope you enjoyed this fascinating veterinary story. We can make an impact in so many places. Check out the show notes for lots of resources. Please make sure you are subscribed on your podcast app, subscribe on the YouTube channel, and follow me on LinkedIn, where I hang out the most. You can contact me on LinkedIn, on the website at vetlifereimagined.com. And brand new is that you can text me. To send me a text message, find the link at the top of the show notes below that says, send us a text message. I want to thank our longtime sponsors, Fire Consulting and Will Hughes, who support the podcast over on our hosting platform, Buzzsprout. You can support the podcast too. Just check out the show notes for a link. And I hope to see you next time on Vet Life Reimagined.